Yes. In 1998, when I was running for office for state representative, not only was I probably extraordinarily fatigued, I had a sore throat, continuous sore throat, started going to the doctor looking for some assistance and didn't get any, but realized there was something wrong. Eventually, that led to having my lymph nodes swelling, and I went to a doctor, throat doctor, sometime in February, and he felt I might have lymphoma. At that point, I decided to go to one of the Boston hospitals. I felt if I was going to go and have an operation or have any kind of problem, I should go to the best. So I went up to Mass Eye and Ear, and at that time, after having a biopsy of the tongue, it was found to have a tumor in the back of the tongue. And, the operation they were proposing for me was pretty invasive. Yeah, I had second, third, and fourth, and fifth opinions. And I went on to another hospital in Dana-Farber and spoke to the leading directors of all of the departments at Dana-Farber, which is a leading cancer hospital in Boston, probably one of the most famous in the world. And they too substantiated that I would need this very invasive operation, which would mean cutting part of my tongue. So it wasn't a very happy kind of situation that I was looking forward to. Then approximately 3.5 weeks, I went in for a test. I had to go for a preoperative test because I was still proceeding as if I would have the traditional operation. And we went through the test, the CAT scan, all of the other operations. Day after the test, the doctor called me up and said the operation was not going to be necessary. And I said, why? And he said the tumor was gone. And I asked him what it was, and he said it was a miracle.
And who was this that said it was a miracle?
This was now a Dr. William Montgomery, who was the Mass Eye and Ear, and who's world-renowned doctor, who I had started working with, who seemed to be the most empathetic and understanding, and also the most accomplished in throat cancer.
So what was his advice?
His advice was keep doing whatever you've done and keep the treatment going. I hope to actually encourage alternative medicine in the state of Massachusetts. I've also worked very hard to get other women and legislators to support this and sponsor it. And I think we're going to make great strides because what we need to do is give people an alternative choice prior to surgery, prior to radiation or chemotherapy. Because I've seen people have all of those and yet have tumors come back.
Hi, my name is Mike McElroy. I'm a personal trainer and nutritional consultant here in Santa Monica, California. For the last 5 years, I've been using Dr. Hulda Clark's method for killing parasites and cleaning people's bodies of pollution. She's discovered that those are the two things that cause cancer. She's also discovered that this is the cause to many diseases. In her new book, Cure to Advance Cancer, Dr. Clark will introduce you to the way that you can actually cure yourself or your loved ones. What we want you to do over this next few minutes is watch the specific doctors and scientists and patients explain to you how they cured themselves, and Dr. Clark explain the method in which she's discovered tumor formation as well as cancer. And you too will be fascinated as we were. Now with no further ado, Dr. Hulda Clark.
Every disease that I saw in my office over a period of, say, 10 years had a dominant parasite involved. Remember, I was testing everybody for a set of parasites, about 70. I list all the parasites in the book, which ones I was testing for. And to my surprise, if you had diabetes, it'd be uretrema, the pancreatic fluke. Pancreatic fluke. Diabetes is a disease of the pancreas.
What about the fluke that you talked about, the fasciolopsis fluke? How did we get that into our body?
It's in the meat and the dairy industry, except in kosher foods. We were just discovering that kosher food, and this will go into the book still, that kosher dairy products do not have these parasites, which shows you it's a matter of cleanliness.
We now have all the people watching this squirming at home because they all think now, okay, I understand, I have parasites in my body, and we all do, according to your research. Yes, of course we do. So according to your research, you've found that all humans have this, and as long as we're healthy, we're okay with it because the body can handle it. My next question to you is, how do we rid ourselves of these tenacious bacteria, parasites, and virus? Do you have an answer to that?
The answer that I came up with already in the first books was the how of the black walnut tree, but the hull has to be green. There is something in the green hull that kills everything I ever tested for, which doesn't mean everything, but let's say close to 100 parasite varieties.
So you're telling me that in all of our pharmacology, all the millions of dollars spent with research in cancer, the native Indians who were using this hundreds of years ago has already had the solution to cancer?
Those who were, yes, but I don't know how much folklore there is around this herbal product, and there are many other good herbal products out there. I'm sure there must be other things that can do the same thing.
But you found this to be the best product.
Yes, and now we have a freeze-dried product which is even more potent than the alcohol extract that we call a tincture. And the apparently freeze-drying preserves some extra elements so that you don't even really need the cloves and the wormwood with it. Now, not enough experiments have been done so that I can say you never need them. But a person can now use a freeze-dried variety and be saved the extra chore of taking so much cloves and wormwood.
I started to be very, very interested in the relationship between parasites and the Candida. So my first thing was I looked into the books from the clinics, books on parasitology, and to my own surprise, when you read books on parasitology, they would say that on some of the parasites, the fungus live on the skin. That is known in the clinic. That is not something new. I read Dr. Clark's book and I see that she says the fungus could live in the parasite. So the thing does not really contradict itself, on the contrary. And that was the explanation, because those people we could not get through with the fungus therapy, they had parasites, and on those parasites they had fungus living. The moment we attacked the parasites with all the Clark, the parasites, is exactly the moment we got through in the fungus therapy. So from that moment on, I was very, very interested. And I started to read all those books. And then I got all the parasites I could get a hold of. And in the meantime, I have more than 90 or 100 parasites. You could see all those. This is a kit I developed, which now in Germany is being very popular. Especially in all people working with the BICOM. They test with this kit. There are more than 50 parasites in there, which are all the flukes and all the nematodes, all the cestodes, all the... it is not enough. My experience is that it is not enough just to treat the fluke. The Phaseolopsis busci. You also have to see all the stages, and it is not allowed that any stages would be on any system left, because if it does and the patient got better, but then we saw that sometimes the cancer can start again, and when it starts again we found that again the busci has developed. So we have to make sure that everything is out of his system and that the immune system is stabilized.